not, I'm going to make sure I'm performing hand hygiene. I'm going to run my gloves. Okay, I'm going to provide for privacy for the patient, and I am identifying myself. Hello, my name is Kon. I'm going to be your nurse today, and I'm going to make sure I identify the patient as well. So just asking the name, the date of birth, okay, and I'm going to make sure that that matches what's on the ID band as well as what is in the chart. So that is an appropriate finding. And I'm going to make sure that we're providing for safety at this time, just noting if there's any IV lines or anything like that running, that the bed is in a locked position. And then we're going to make sure when we get to the fundal assessment that we're going to lower the head of the bed, and then when we check for hemorrhoids that we cannot turn her to the side. So just verbalizing that. So at this point, I'm going to make sure that I am assessing the vital signs. I will take the temperature, blood pressure, respirations, pulse ox, listen to the apical pulse, which is appropriate, and I'm also generally assessing her ABCs. I can tell that the airway is open and patent. She is able to communicate with me effectively and appropriately. I see the rise and fall of the chest, so she is breathing. And then I'm just looking at her skin color. It is appropriate for ethnicity, and it does appear to be pink and dry, so that is a good finding. I could also assess capillary refill at this time, which it is, I can see, less than 2 seconds, so that is appropriate. So ABCs are intact, as are vital signs. So at this point, I'm going to make sure I'm going to use my stethoscope, if I can just borrow that from my lovely assistant. Thank you. Okay. And I'm going to make sure I'm going to listen to the lung sound as well as the heart. Again, noting that apical pulse. Okay. So I'm going to, can you just take a couple deep breaths for me, please? Okay. Comparing side to side. Maintaining privacy as well. A couple more. Good. All right, you can breathe normally. And then I'm going to listen to the heart, aortic, pulmonic, tricuspid, and mitral. Okay. And I'm just going to verbalize. I would also listen to the lung sounds posteriorly, anteriorly, left lateral, right lateral. I was able to hear S1, S2, which is appropriate. There was no S3, S4 gallops, clicks, or rubs, or extra heart sounds noted. So that is an appropriate finding. So we've listened to the lungs, we've listened to the heart. We're going to document that apical pulse, which we would verbalize it was around 84. So that is an appropriate finding. And at this point, I'm going to move on to perform our focus assessment, our bubble her assessment. And I'm going to be just starting with the breast. So if that's okay, I'm just going to make sure I'm providing for privacy, only exposing one breast at a time. Okay, just going to look here. And again, I'm communicating and verbalizing to my patient and asking her if she's breastfeeding, if she's having any problems latching. If so, we can make a recommendation for a lactation consultant. So that is good. So I'm just going to look here, and I'm noting first, I'm just inspecting generally. I'm looking at the nipple. It is everted. There's no inversions or dimpling, so that is appropriate. And then I'm looking to see for any signs of infection. So I'm going to make sure that it's not red. Some tenderness can be normal, especially that first 24 hours to 48-hour period until that milk starts to come down. Then she may experience some engorgement, but there shouldn't be any signs of infection or mastitis. So I would again verbalize it to the patient. If she is getting any pain or any very hard breast or any redness, that's something to report to the nurse or to the provider. So again, I've assessed the nipple, and they should be soft at this point because she is within that first 24-hour post-op period. So that is good. And I'm palpating bilaterally, okay, and they do appear to be soft. And I'm noting for the presence of colostrum, okay, which is what we call that liquid gold, full of those rich antibodies, okay. Wonderful. So at this point, we've assessed the breast, and then we're going to make sure we're assessing the uterus. So I'm going to make sure I lower the head of the bed, okay, and I'm going to, yep, making sure she's comfortable at all times during the assessment, providing for privacy. All right. Make sure she's completely supine. supine, dorsal recumbent position. Okay, and I'm just gonna take a look here. Okay, carefully expose this area. And before we start, we're just gonna make a mental note that she is within that 24-hour period. So we should note that the level of the fundus should be within the first 12 hours at the level of the umbilicus, and then 24 hours, each 24 hours thereafter, it should descend and go down 1 centimeter in that process of involution. So it should be shrinking down, contracting, so we're going to prevent postpartum risk for postpartum hemorrhage. Again, I'm also asking her one of the first things to notate was the last time she peed. What was the last time she voided? How much? We really want her voiding more than 300 mLs, especially every 2 hours, especially within that first 2-hour period, in order to prevent displacement of the uterus, in order to keep the uterus in the midline, and to keep that firm, contracted again, preventing that bleeding. So I'm going to make sure I'm going to support the lower uterine segment here to prevent uterine inversion. Okay, and I'm palpating. Okay, I am noting the consistency. It is firm. There's no bogginess. The uterine atony, which would indicate possibly a postpartum hemorrhage. So that's good. So there is no indication for a fundal massage at this time. I'm noting the fundal height. It is at the level of the umbilicus, and that is appropriate. Again, because she is within that first 24-hour period. Okay, and I did ask her if she voided, and she did verbalize she has been voiding appropriately. So that is good. So that is an appropriate assessment finding. At this time, I'm going to also make sure I'm listening to the assessing the bladder. Okay, so I did ask her the last time she voided, what was the color, if there was any foul odor, if she noticed any clots or any blood in there. We would make sure we're documenting that as well. And as far as assessing the bowels, I'm going to listen to the bowel sounds. Listen to all 4 quadrants. So bowel sounds were present and normal active in all 4 quadrants, so that is an appropriate assessment finding. Again, I would just verbalize, we would do that also towards the beginning of the assessment, so that is appropriate. At this time, I'm going to make sure to assess the lochia. I'm going to make sure I'm assessing the color, the amount, if there's any foul odors, and we would definitely be weighing those as well, weighing all the soap linens and the pads, and then subtracting from that dry weight in order so we can continually assess that estimated blood loss and make sure she is not having a postpartum hemorrhage. So I'm just gonna ask her, when was the last time you changed your pad? And she did say she changed it about 30 minutes ago. So definitely this is a good time to provide some education that she shouldn't really be soaking the pad within an hour, within less than an hour. That is a sign of hemorrhage. So that is appropriate. It does appear to be moderate. It does appear to be lochia rubra, which is red. So within that first 3 days, that is normal. Then at like day 4 or 5, it should start to get darker, pink, brownish, and then by day 10 it should turn white. So definitely if you see any increases in bleeding or any return to a bright red blood, please make sure to let us know, because that is definitely something we need to be notating. Okay, and I'm not seeing any clots. Typically, if they're larger than a walnut, we would really want to weigh those and assess that as well. So that does appear to be appropriate, and there's no foul odor that I'm noting, so that's good. Okay, at this point, we're going to also verbalize the need to turn our patient because she did have an episiotomy. So we're going to be turning our patient. We're going to be assessing for hemorrhoids. Again, we're going to be using that Rita assessment for checking for redness, ecchymosis, edema, which is swelling, any drainage, any purulent drainage, because there should be, again, no signs of infection. And we really want to make sure that incision is well approximated. So I'm going to make sure I'm assessing that, again, turning my patient, and notating for the presence of any hemorrhage as well, which can be exacerbated with the label. So that is appropriate. Again, assessing, the bowel movements if she does. If there is an indication for a stool softener, we would also make note of that as well. Again, asking when was the last time she had a BM. She did verbalize that was before birth, and it is okay. It's completely normal, especially if there was some sort of anesthesia used or pain medication. That is an appropriate finding. So definitely you want to see your bowels come back within a week. That bowel movement. If not, be sure to let us know. And again, I'm going to be removing my gloves after this portion of the assessment. Okay, and I'm going to perform hand hygiene. Okay, and at this point, I've probably done another pair of gloves just for extra patient safety. So we've assessed for lochia, episiotomy, hemorrhoids. We're going to make sure we note for any DVT. Okay, so we could perform the Holman assessment. So this is push. Okay, was there any pain with that? No. Same here. Okay. Although typically we don't really use this in clinical practice too often, we're really noting for the clinical manifestations of a DVT, which would be some sort of swelling. Do you have any pain in your calf at all? And we're just looking for any edema. Okay, any redness. At that point we would need to assess with a Doppler to make sure. Because after blood flow, I can also assess pedal pulses, which there are 2+ present bilaterally, so that is an appropriate finding. And definitely encouraging that early ambulation, deep breathing in order to prevent DVT formation. So we really don't want you to get a blood clot or anything to go to your lungs. So we really want to make sure you're up and walking as appropriate, and there's no hypotension, so she's definitely okay to walk. So that is an appropriate finding. Again, we're going to notate her emotion, her level of consciousness. So I see she's alert and oriented times relative person, place, time, and situation. And I'm just generally assessing her affect. It does appear to be pleasant, and there is outward expression. She is in the taking in phase of her transition to motherhood, so that is appropriate. We really want to provide for her needs at this time, as that's the focus within the first 24 hours. And then again, we would be providing information on postpartum depression and the postpartum blues, which are definitely normal. It's okay to feel a little bit down for that first 2-week period. And then also involving the family. If they notice that this is lasting for greater than 2 weeks, definitely that is something to report definitely to the provider or the nurse on every encounter. So making sure that is intact. So we've assessed that level of consciousness, again, that emotion. We've also assessed her prenatals prior to this. And we are notating her rubella status. And I did check in the chart, she is rubella immune. Okay, and she is A negative, that is her blood type. So definitely, since she is A negative, we would have administered Rogan prophylactically at 28 weeks. So that was done, and then within 72 hours, if the baby is Rh positive, we would definitely administer an additional dose of Rogan. So we would also give any immunizations at this time if they were indicated, but again, her rubella status is immune, and she was negative for HIV, hepatitis B, chlamydia, gonorrhea, etc. And so I'm going to make sure I reposition my patient, making sure she's comfortable. Okay, is there anything else I can do for you? No? Okay, wonderful. So again, I'm going to provide for safety measures, making sure that we have at least 2 side rows up. Again, visually assessing that IV line, lowering the bed, locking the bed, maintaining privacy at all times. Okay? All right, and that concludes our assessment. Thank you.